Can this weight loss medication cause problems with your heart? If you're taking Zepbound or considering it, you might be wondering whether it could affect your heart. It's a fair question, especially when starting any new medication for weight management. Here's what you need to know up front. Based on current clinical trial data, Zepbound does not appear to cause serious heart problems directly. However, some of its side effects can indirectly affect your cardiovascular system, and there are important nuances to understand. Let's start with what Zepbound actually is. Zepbound, also known as tirzepatide, is an FDA-approved medication that works through a dual mechanism. It targets both GIP and GLP-1 receptors in your body. This helps reduce appetite, slow digestion, and support weight loss when combined with diet and exercise. Now, here's the important part about heart safety. In clinical trials involving thousands of participants, Zepbound showed no increase in major adverse cardiovascular events compared to placebo. That's reassuring. Even more, participants actually saw improvements in blood pressure and lipid profiles, which are markers of heart health. But here's the nuance you need to understand. These trials weren't specifically designed to prove cardiovascular outcomes. They monitored heart safety, but proving heart protection wasn't their primary goal. Right now, dedicated cardiovascular outcomes trials are ongoing to give us more definitive answers. So while the data we have is encouraging, we're still learning about long-term cardiovascular effects. It's also important to know that Zepbound is not FDA approved for cardiovascular risk reduction. It's approved for weight management, and while weight loss itself can benefit your heart, that's different from being proven to reduce cardiovascular risk. Now let's talk about the indirect effects. The most common side effects of Zepbound are gastrointestinal, things like nausea, vomiting, and diarrhea. If these symptoms are severe or persistent, they can lead to dehydration, and dehydration can cause problems like a rapid heart rate, palpitations, or feeling dizzy when you stand up, which is called orthostatic hypotension. This is why staying hydrated while taking Zepbound is so important. If you're experiencing vomiting or diarrhea that lasts beyond a day, or if you can't keep fluids down, contact your doctor right away to prevent dehydration. There's another detail worth mentioning. Studies have shown a small increase in resting heart rate in people taking tirzepatide. For most people, this isn't a problem, but if you have arrhythmias or existing heart disease, this is something to discuss with your healthcare professional. They may want to monitor your heart rate more closely. Certain people need extra monitoring when taking Zepbound. If you have a history of heart failure, recent cardiovascular events, or cardiac arrhythmias, your doctor will want to assess your situation carefully. This doesn't necessarily mean you can't take Zepbound, but it does mean you'll need closer monitoring to ensure it's safe for you. Before starting Zepbound, make sure your healthcare provider knows your complete medical history, especially any heart conditions. Tell them about all medications you're taking, since some can interact with Zepbound. And be honest about any symptoms you experience once you start treatment. Your doctor will prescribe the right dose for you and adjust it over time as needed. Always take your prescribed dose as directed. Don't adjust it on your own. While taking Zepbound, pay attention to how you're feeling. Most side effects are manageable, but some symptoms require immediate medical attention. Seek emergency care right away if you experience chest pain, severe shortness of breath, fainting, or any signs of a stroke like sudden weakness, confusion, or difficulty speaking. Also contact your doctor if you notice a persistent rapid heartbeat, ongoing dizziness when standing, or palpitations that don't go away. These could be signs of dehydration or other issues that need to be addressed. Here's something positive to keep in mind. Weight loss itself can actually benefit your heart health. Losing excess weight often improves blood pressure, cholesterol levels, and reduces strain on your cardiovascular system. So, while you're monitoring for side effects, you may also be experiencing positive changes in your overall heart health. Remember, everyone's body responds differently to medication. What works well for one person might cause more side effects in another. That's why ongoing communication with your healthcare provider is essential. They can help you weigh the benefits against any risk specific to your situation. So let's recap. Zepbound does not appear to cause serious heart problems based on current evidence, though the trials weren't designed to prove cardiovascular outcomes and dedicated studies are ongoing. The main cardiovascular concerns relate to dehydration from gastrointestinal side effects and a small increase in resting heart rate. These can be managed with proper hydration, monitoring, and medical guidance. And if you have existing heart conditions, you'll need careful monitoring, but that doesn't automatically rule out this treatment option. Always consult your healthcare professional for personalized medical advice about whether Zepbound is right for you. What's been your experience with weight management medications? Drop a comment below. And if you found this helpful, hit that like button and subscribe for more evidence-based health information.